Believe it or not, I had this all organized before I left. And then I switched it.
That's why I don't bring it.
Does that help?
I think he wants you to raise his hand. Raise your hand.
It's a silent raise. No, I did have it here somewhere, but.
So before we start the meeting, I just such
You've
an,
been given the high sign, it's okay to start.
Is it okay to start?
Okay.
Thank you, Steve, I appreciate it. We do have a quorum. This is going to be the public health meeting for the city of Nashua. Bobby, would you like to read the preliminary material? Read the preliminary material?
Well, since we're not on Zoom, there's,
Well, the mission statement.
well, we are no longer meeting on Zoom, so we're all in person.
Okay. Sounds good. No calling in, nothing like that. Very good. All right, I'd like to start by having somebody move the minutes of the past meeting.
so moved.
Thank you. I'll second it. Doing the house cleaning, any cleanups, amendments? No? Looks good.
job.
Vote to approve? Yes?
So moved.
Yes. The board minutes of March 9th have been accepted. Lindsay, situational update, please.
Sure. So I'll first start by talking about the new BA2 variant, and then I'll give an update on New Hampshire and Nashua statistics.
Thank you.
So we've had a slight increase in cases overall within the U.S. because of the new BA2 variant, which is a type of Omicron. There was an 86%, so 86% of cases that were submitted for additional genomic testing within the U.S. were confirmed to be the BA2 variant. The U.S. has had a 10% increase over the last 14 days in cases. As far as the Northeast, we have had the most case acceleration compared to any other region in the U.S. And just to give a little bit of a comparison as to what's going on in other countries with BA2, China, which did not have any surge at all at the beginning of the year, is now having the biggest surge they've ever experienced. And then as far as the UK goes, they experienced a large Omicron surge like the US, and now they're having a smaller surge, which they're coming down from, of the BA2. For New Hampshire statistics, we've had 304,503 cumulative cases, 1,542 active cases, and there was a 42% increase in the average cases per day compared to the last 7-day reporting period. For current hospitalizations, there are 40 people in hospitals that are COVID-19 positive, and 13 of those are being treated with antiviral medications. There is a total of 2,463 deaths within the state since the beginning of the pandemic. And for Nashua statistics, we've had a total cumulative caseload of 21,408 with 102 active cases currently. The new case rate for Nashua is 189.6 new cases per 100,000. And we've had a total of 153 deaths. As far as hospitalizations go within Nashua, between St. Joe's and Southern, there are less than 10 COVID-19 positive patients. And lastly, I just want to cover the COVID-19 community level metrics by the CDC. That's based off of new COVID-19 admissions per 100,000 population, and percent staffed inpatient beds used by patients with confirmed COVID-19. As of right now, for Hillsborough County, we are still in the low community level, which means for guidance by the CDC, stay up to date with COVID-19 vaccinations, get tested if you have symptoms, and wear a mask if you have symptoms. You can also wear a mask on public transportation, and you may choose to wear a mask at any time as additional precaution to protect yourself and others. And that's all I have. Thank you.
Any questions for Lindsay?
Lindsay, could you please comment on the way that COVID cases are being counted now? The reason I'm asking is because in the past, there was so little availability of home testing. And so most of the cases were tested in a facility, and there was a reasonable handle on how many cases actually were being counted. It's my understanding that a number of states, including New Hampshire, have gone to counting cases that are being treated in a hospital or treated with the one medication now that seems to work, the Paxlovid. So I'm wondering how accurate are these statistics, because is this the tip of the iceberg is what I'm asking.
Right, and that's a very good question. So to be very honest, this is probably an undercount of what's going on in the state because they are not collecting information on at-home testing. It's very difficult to say what the actual numbers are right now, and it's getting harder and harder, and it will probably continue to get harder.
So what we're seeing are validated cases done in a lab or at
Yes, no
whatever it
at-home
is,
tests, just,
testing site, not, so this is the minimum
yes.
of what we have in the state at this time. The other thing is that, because of the variants and their resistance to some of the original treatments, there's, I think, a lot of confusion in the community about what is an appropriate treatment. I just learned of a patient today that had a serious case of COVID. The person happened to be unvaccinated, and they were prescribed Paxlovid, which is the one medication, that oral medication that works, and they wanted to know what to do with their ivermectin while they were on the Paxlovid. And I know there's been a lot of controversy about ivermectin, but there is a recent report in the most highly respected New England Journal of Medicine that's a controlled trial that shows that ivermectin does not work. So what information, where can people go for information, and are those studies available? Are we able to promote, because we're saying here, wear a mask to protect yourself, but also, the concept of those medications need to be started within the first few days of symptoms to have an effective protection, especially for those who are unvaccinated. So could you comment on that, please?
Sure. So a great resource as far as guidelines go to treatment of COVID would be NIH, National Institute for Health, because they have guidelines on the antivirals. And it also does speak a little bit to ivermectin and how it's not really effective towards COVID-19. You could also check CDC's MMWR, so mortality, morbidity weekly report. That also speaks to those as well. I'm not sure if it speaks a lot to ivermectin because it's not really effective, and you have to weigh risk when prescribing that for a virus and how many studies would actually be done.
Yeah. Well, not that the new information is
Yeah.
with us, just,
Yeah.
Thank you very much.
Yep.
Okay, thank you. Just a question, have they changed any of the travel restrictions to countries, or obviously nobody's going to China, but
I
UK?
do not know as of right now, but I can get back to you on that.
I just wondered if you've heard. Okay. Any other questions?
I could comment on
Oh,
that
go ahead.
immediately. So they haven't changed any of the travel restrictions. Right now, anybody traveling into the United States has to take within 24 hours a rapid test. So it's not the PCRs 72 hours in advance anymore because of the epidemiology and how quickly the BA2 is transmitted and infectious. They, however, just extended the mask mandate for airplanes. Another 15 days it was due to expire. And it's also worth noting that the city of Philadelphia has reinstated their mask mandate due to a huge surge and the fact that that's a form of protection. Thank you, Lindsay.
Thank you. Any other questions? Seeing none, I'd like to move on to Bobby, the director's report, please.
Yep, thank you. So as usual, I'll just read our vision and mission. Our mission is to promote, protect, and preserve the health and the well-being of the Greater Nashua region through leadership and community collaboration. Our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. And we subscribe to the following values of integrity, leadership, adaptability, and respect. As you've noted, we are now having our meetings here in City Hall, and that is to have the opportunity of the taping and the recording and the live playing of the meeting, and to also have additional space if public decides that they want to join us. With the Zoom, we did notice that if we were having quite a bit of difficulty with the audio, especially being able to hear softer speaking folks. And so this gives an opportunity for everyone to hear without there being any challenges with that. So thank you, everyone, for joining us here in the City Hall Auditorium, and this is where we will continue to have our meetings
Okay.
going forward.
All right.
Financial update, so we did our 23 budget preparation for each of our departments. Each of the managers worked very well and looked very carefully at the department needs, even including looking at making some changes for salaries for some of our positions at the division so that we can make sure that our compensation for our staffing is appropriate. We did do a presentation to the mayor and finance director on the 11th. And so we expect to hear, we presented our proposed budgets for each of our departments. And so the mayor will be reviewing that, and then we'll have a chance to present those before the aldermen in May. I did have the narratives attached because what we do is each department puts, in addition to the budget request, a narrative that describes the type of work and the outcomes from the previous fiscal year and our goals going into the next year. So you should have that attached in your reports, or should have received that as well. All of our grant-funded programs are now into the fourth quarter of deliverables, and we're all working on our spin downs. Community Health and Community Services have the bulk of the grants at the Division of Public Health and Community Services, so we've been working really closely with our admins and with our program coordinators in making sure that we spend down the monies appropriately. There will be, because we had gotten so much additional funding because of COVID, so some of the monies that aren't expended in this fiscal year of 22, many of the grants that we have under community services will be able to be rolled over. Some of our regular grants at the end of this fiscal year, they will just end, and whatever is not expended will be lost. And so that's why we're working very diligent to make sure that we can spend those down. I also have included in the report policy update, and so there was a crossover event that occurred on Monday, and I had that link in there. Then if you chose to participate in that, New Futures gave an update on all of the bills that were crossing over. So if they began in the House, they crossed over to go before the Senate committees, and vice versa for bills that started in the House of the Senate went, or at the Senate went to the House. And then you'll hear from a couple of the managers on, well, Heidi will talk about the presentation at the State House for two of the bills that we sent some letters in opposition to. So we sent 2 letters of opposition for the health officer and city officials, and then also sent a letter of opposition for some of the changes with regards to the registry. And Jane Goodman, our public health strategist, presented at that hearing last week. And then I also included in the public hearings that were scheduled for this week, and so I mentioned the Senate Law Municipal Affairs Committee that was held on the 11th. Heidi will talk a little bit more about that. And then you also have a list of all the other bills that are coming up at the State House. And what New Futures has done, they've made this really easy for us in public health, for constituents, for our Board of Health members to go on to their site. You can click on any one of these bills, and then you can also either click on support or oppose, and you can even write a short sentence or two as to why you're either supporting or opposing the bill. And then they take all that information, and they also work as advocates on behalf of public health, and they attend these hearings and have folks that attend as well. And so I do make sure that I include these so that you're aware of this. And anything that comes up that we need to be aware of in between our board times, you will receive those as well so that we can get some immediate action on those. We celebrated Public Health Week last week, I believe that was last week. And so you can see all of the fun that we had. It was a very busy week. It was also a very encouraging, informative, and supportive week because we had our community partners engaged. We did a walk with the mayor. We also had a resource fair where we had many of our community partners actually participate in that and we did that in collaboration with the City Wellness Committee as far as engaging city workers as well. Behavioral Health submitted and received a $10,000 grant for Speaking Our Minds. This is going to be a radio show in Spanish, Portuguese, French, in Swahili that's going to focus on mental health awareness. We continue to hear and learn that mental health is an issue in the community, not just with adults, but also with our youth. And so this particular project will focus on having some of our youth come in and talk on the radio about what's happening with them. And then this will program also includes a portion for adults as well. And they'll discuss signs and symptoms of mental health and the importance of language and resources. And during public health emergency preparedness, our public health emergency preparedness coordinator and our public health network services strategist have met in person with our municipalities, and so we're making sure that we make contact. COVID gave us the opportunity to reestablish relationships with our region. Nashua is a place where there's a lot of resources, and so a lot of our surrounding towns, constituents from those towns come to Nashua. So we're making sure that we continue to foster the relationship with those health officers and with the emergency management directors by seeing what their needs are going forward. We have a focus on addressing, maintaining the health and wellness of the community at the highest level that we can, including our surrounding partners as well. And so we want to make sure that we keep those partnerships engaged as we move forward. Our community health workers have continued to do community and partner engagement as well. And during the month, they coordinated nutrition and cooking matter classes with UNH Corporate of Extension, and those are held at the First Church with community members. They've also held an equity session in collaboration with Southern New Hampshire AHEC. And so one of the things that came out of the governor's COVID equity report was on making sure we can get as many community health workers throughout the state connected with organizations so that they can meet individuals in the community where they are, be able to address and talk with folks in their first language and understand their cultures. And so they convened a group of community health workers that are in our region to come together so that they could discuss what types of barriers and challenges that they're up against and get some strategies from one another. So that's going to continue on a monthly basis. We had our another session of ELL students in collaboration with the Youth Council, our community health workers, again, wanting to be present and provide information in the first language of the youth that are attending those sessions. We just finished that up. It went very, very well, and so they're going to start another set of sessions I believe they're going to be moving to the middle schools. And that's, as I mentioned, collaborate with the Youth Council. As far as staffing updates, we have all of our positions filled except for one. We're still looking to hire a public health equity officer. I have 5 applicants. It has 4 here. I got another one. 5 applicants to consider, and so calls will be made to connect with those individuals. We have a medical student that completed their practicum, and we have a new public health student that is working on his internship, and he's working with the behavioral health team on doing an assessment of the 10 years of services that have been provided through the Charitable Foundation and our Bureau of Drug and Alcohol. We have done a number of workforce development things, including completing the workforce development survey, and that's for accreditation because we submitted our application for that. There are a number of conferences that our staff will be attending, and some have attended already. And then we still continue to participate in the homeless training workshops. And then I just listed some of the meetings, the boards and commissions that I've attended during the month. And, again, the purpose of that is to make sure that we can maintain representation of public health and provide information and act as subject matter experts on some of these boards and commissions. And that's my report. Any questions?
Thank you, Bobby. Any questions for Bobby?
The only question I have, and it may be something that Bob can address during his report, is in past years, when, for example, the welfare department has not used up all their funds, it's affected their budgeting. And Bob was thorough enough to include in his report that we spent less because there had been the, Recovery Act funds. So I just want to, at some point, hear a comment about if there's any concerns about the budget, that because of the difference in circumstances that we may face last year versus what we're showing for this year, so.
Mhm. Do you want him to
just-
tackle
I
that
could-
with his?
I could
Yeah.
discuss that now or wait for the report,
It's
whichever.
entirely up to you, I
Um,
just didn't want to lose the thread.
Sure.
To make sure you had the
Um,
resources you needed to meet the needs of the community.
Sure. And that's a great question. Bob Mack, Welfare Officer for the City of Nashua. It's part of what we had discussed at our budget presentation to the mayor and his team. We are proposing a slightly reduced general assistance budget for this upcoming fiscal year. And as you noted in the report, it shows a decrease in the level of expenditures, and that is primarily due to many folks in the community getting services and supports through a lot of these emergency assistance funds, primarily through the CAP agencies managed by the Housing Authority. That funding is set to remain in place for the next couple of years,
Okay.
as long as they still have funding. So if they go through the money, they got about $180 million to the whole state.
Yep.
So as long as that money lasts, they have the next couple of years to spend down that money. and
Okay, I didn't
process
realize there was
applications.
enough to last
So,
past this fiscal year. Okay.
but there are, stipulations and eligibility requirements for that
Yeah.
as well, as there are for most programs.
Right.
But what that has also done is, it's impacted not only our budget and reduced our need to expend some of our funding, but also a lot of our partner agencies haven't had to spend some of their emergency assistance funds as
Okay,
well.
great.
So, not that they have a large amount of money just laying around to spend, but they have been able to save some of that money that they may typically have spent at this point in time.
Okay.
And there are different programs that come up all the time across the board for different services. And we also discussed some of the nonprofit community partners in our community that were struggling with fundraising over the last couple of years, but there was state money to help them supplement that as well. That will no longer be in place, so they're moving back to their traditional
Oh.
fundraising. So we just try to keep our eye on all these programs that are in the community that might meet the needs for our folks.
Okay,
So
thank you for
I
that
hope that
information.
answers your
That's good.
question.
Thanks, Bob. Any other questions? Seeing none, okay, my fountain. You're up.
Great, thank you. Kim Bernard, Chief Public Health Nurse for the city and the manager of the Community Health Department. I'm reporting out for March 2022. And some of our highlights include some program highlights. Our immunization and sexual health programs, we are continuing to increase support and education throughout the community through presentations, outreach clinics with our partners, as well as practitioners who are participate in the Vaccine for Children program. We are up to date on all of our VFC visits. Under our lead program, we are seeing that our cases are slowly trending up, which we expected. We are awaiting the new test kit. It was federally recalled, and all of the organizations in the area are still waiting for those. So we are patiently waiting. We really want to get those in our hands so that we can start screening again. We did go live, and I had mentioned at the last meeting as well, working with the new state database, and that will enable us to, have better data and a more efficient way of tracking our case management cases. That's going well so far. SANA, in our SANA program, we are planning to routinely offer HIV testing at our SANA outreach, which is 2 times a week on Mondays and Wednesdays. And we'll be increasing staffing to those sites so that we can deliver that service. We do have incentive gift cards that we are going to give out to those clients that choose to utilize those services. In behavioral health, we are partnering with our behavioral health specialists in the community health department. Our behavioral health and disease disease nurse, Liana, she has been working with the behavioral health specialist to coordinate increased education to our community and community partners surrounding mental health issues. She's been doing a lot of different classes. She's been involved with the mental health first aid course, where it was an instructor course. So she will be working in the community to deliver this class starting in May around the community with our partners. Workforce development. We continue to encourage our staff to attend different educational offerings, such as conferences and webinars, seminars, trying to get out of the building to attend some things finally. And that will increase our knowledge base and improve outcomes with our services. So I was able to attend a Sigma Theta Thou nursing conference in DC over the last month on creating healthy work environments, which was really good. And then we also have our two of our staff members right now, Liana, who I had mentioned, and Robert, one of our community health workers, who's at the NatCon, which is focusing on mental health, behavioral health, and SUD. So they should be returning from that later this week. We also did complete the third training in the homelessness core training, and we have started another series surrounding that, which all of our staff in our department are attending. So, and that's the highlights. If you have any questions.
Any questions for Kim?
Well, rumor has it Hitchcock and Manchester has the kits for the light.
Really? Good to know. So
you
it's
know,
getting
We
closer.
haven't gotten it in Nashua yet, but.
What's that?
We haven't gotten ours in Nashua, but.
Will you let me know
I will
when you
let
get
you know.
yours? Okay.
Yes.
And we'll follow up again, but we've been kind of on them, emailing. But yeah, thank you for that.
Any other comments, questions? Seeing none, we're moving on to Heidi, environmental health, please.
Thank you. Heidi Pete Kokoka, Nashua's Health Officer, reporting on March of 2020. Our food service failure rate continues to lessen, and we're very excited about that. We're seeing that food service facilities are doing better than they have in a while, but it's still concerted effort. A lot of credit goes to our staff for delivering a lot of education in real time, one-on-one, about the relevance of food safety. And we still seem to see quite a few change of ownerships here and there. So it's interesting to see what happens after a pandemic. Septic is gearing up again as everybody wants to get out and develop property. So Ren has been very busy with that. He says hello to everyone, too, by the way. And nothing else really jumps out at me with our school inspections. Complaints are pretty much the same thing. We have seen, I've noticed, it seems to me, a higher number throughout the state of rabid animals recently. So we're just kind of watching that. One of our bulletin boards is going to be focused on rabies and how to avoid those wildlife exposures, because that is critical. Revenues are on the next page, and those have gone up a bit, and you can see the tiny little blip for the septic revenues, so we'll see that continue to grow. We are just renewing our pools this month, so we'll be putting that on here too. As far as legislative updates, Ren and I both attended the hearings in front of the Senate committees for House Bills 1272 and 1268. And he and I both testified for 1268, which was the authority of city council bylaws. And I think that it seemed to me, and I hate to use vague words like that, but based on the questions that the senators were asking the sponsor of these two bills, they were rather pointed in trying to figure out what the motivation was to limit the authority. And one of the senators actually asked if it had to do with mask mandates, which indeed it did. That's what the driver is behind both of these. So we had a good opportunity to explain that the parts of, specifically for 1268, the language that would change in the best interest of the community, and I'm paraphrasing, to be changed with something to do for the enjoyment of property it's very different, because we don't want to be tied into something more narrow, and then the one for the health officers goes into nuisances, and it's trying to limit what decision-making can be made at a local level, both in the cities and in towns. So I was somewhat optimistic leaving that meeting and thinking that the senators who would be making that decision at least kind of understood what it was about, and that it's not a good idea to limit the authority within the cities and the towns. So I'm very hopeful with both of those. And let's see, we've taken advantage of, this is for workforce development, FDA with COVID didn't do their annual meetings or their big live trainings. So they rolled out some really fantastic courses. And so our environmental health specialists and Ren completed the temporary food establishment course, which was really good. But it's one of those intense things where you have to be visible at all times because it's the federal government in front of the screen. You can't have any type of a glitch in connection problems, which was a little bit of a problem here and there. But they learned a lot. We also felt pretty positive that we're doing things the right way in Nashua. We also had people complete the certified pool operator, so everyone in the department other than our office manager has taken the course. It is an arduous mathematical exam at the end, which took me by surprise, which is probably why I bring it up now, because I was a little shocked going into the exam. So I have some, and that goes into some of the legislation that's changed too. So I think the next courses that they're taking for FDA are special processes, so that would be like low oxygen packaging, sushi types of things like that. And can't remember the other one, but it's been a tremendous opportunity for us because they're free of charge. Not the CPO course, but the FDA ones. And both Ren and I are very active with New Hampshire Health Officers Association, and we've been working a great deal on all of the legislation that's been proposed, especially those two bills, but some other ones as well pertaining more specifically to food. We've been busy with outdoor dining. I understand that passed the Board of Aldermen last night for the expansion with the barriers. And so we will figure out how we're going to approve that. And that's really not us as much as it is DPW, but we just want to make sure that there's nothing unsafe as far as food handling and preparation going on outside. There are new pool rules requiring a certified pool operator for each of our public swimming pools, sorry. And this kind of took us by surprise. I have a call into Dory. We're trying to figure out how to handle this requirement because we do not necessarily adopt the state code that has this change in it, and we're also trying to guide people on resources as to how this is going to be enforced, where they can go for training, and what the minimum requirements are. We have a situation going on in where it is 11 duplexes, so 22 homes, with a shared sewer pump that has been in failure. And so we've been spending a great deal of time on that because the last thing we want to do is displace 22 families if there is no way to fix it. And last thing, other than the budget, is that we did receive from the Department of Agriculture the emergency spray permit for mosquitoes for this year. just in case. We've never had to use it, but it's there in case we have something really significant that happens in Nashua.
Okay. Thank you.
Thank you.
Any questions? I know my ears are failing me, but I thought at the beginning you said March 2020. So, like I said, my ears might
Oh,
be failing.
22?
So it should be 22, so when we're writing it out.
Yes,
That way
sorry.
we don't have to have a house cleaning on that.
Thank you.
No problem. My usual question is ticks and Lyme disease.
Uh,
What's the,
It's been so consistently moist that ticks are really out there. There are lots of them. We're seeing different stages, and I'm using my husband as a mental model because when he walks the dog, he always,
the same thing.
yeah, so they're there. We have heard from our mosquito vendor that she expects it could be a bad mosquito year because we haven't had a little blip of drought. It's been really moist for quite some time.
Okay.
So not,
Beware.
yes, beware. So we need to get the messaging out and make sure that people are encouraged to use bug spray of one type or another.
Okay. Thank you very much. Any
Thank
other
you.
questions? Yes.
Oh, can I just, back to the House bill thing. You had mentioned the senator that might have been driving these questions was against, I take it, against mask mandates? I don't know, how does that relate to limiting your authority to do what you want to do?
The state rep, who was the prime sponsor on both of these bills, is opposed to mask mandates.
But how would it limit you as a health worker to limit your scope of practice, if you will? Is there a connection there that I'm not sure?
Decision-making and enacting rules within policymaking, either at a town level or city level. Am I not so
Steve, you
asking?
could correct me, but I think if the state has a mandate, or removes a mandate, and your city has a mandate, just like federal guidelines on things, that's the minimum standard. If you want to be more than that, you can do it. And so my understanding of the bill is they don't want people on the local level to be making these decisions.
What you described is often the case, not always, and it depends on the specific legislation. I think this particular state representative is opposed to mask requirements, but basically opposed to anything that limits freedom of choice for any individual. So it would be consistent with the not requiring motorcycle helmets, not requiring the wearing of seat belts, not requiring vaccinations for enrollment in school, those sorts of things. But these particular bills go much further than that. It would prohibit any health regulations
Right.
on the local level, except in these very limited circumstances, like protecting property, not protecting people, protecting property. And each of the two has different, but they are, instead of saying that a city council can enact regulations to protect the health and safety of the community, it has shrunk that broad grant of power down in each case. One deals particularly with health officers making requirements, and the other with city councils enacting things. And it would
Thank you.
limit it greatly. So even though this particular person seemed to be particularly offended by mask requirements, the remedy is not to have something that talks about masks. The remedy is to shrink authority at the local level entirely.
Yes, that was the connection I couldn't make. Okay,
Sorry.
sorry. No, thank you.
I misunderstood that a little bit.
Oh, no, thank you.
The sponsor was discussing some legislation in New York that I wasn't quite able to follow, and I haven't been able to look it up to see what she was talking about. But during the hearings before the legislature, it was a little bit more subtle and quiet about masks, and this was stated more broadly, primarily because the senator asking the questions asked specifically and opened it up.
So not the sponsor, a different senator.
Yeah,
Yeah.
okay.
Thanks,
Thank
Steve,
you.
for the explanation.
Thanks so much.
Appreciate it, clarification. Any other questions?
You make a good translator.
Welfare? Bob Mack?
Good afternoon again. Report on the Welfare Department for March 2022. I'll make sure I get the 2022.
Yeah.
Well, we already discussed the reduction in expenditures, primarily due to other programs that are available to assist in the community. You could see our percentage of those that received direct assistance from the Welfare Department was down to about 37% versus about 51% last year at the same time. So some of these programs weren't in full force. So we continue to assess people's eligibility and refer them to these programs as appropriate and as they are available. We continue to work with our local shelter programs. We did house a few families and individuals in emergency motel assistance. Some of the funds available through those other programs in the community do provide support in motels for folks for, I believe it's up to 90 days. So that also reduced the need for us to assist some of those folks. The shelters continue to operate pretty much at capacity level. We do work closely with our outreach teams, our community health workers, as well as the outreach workers from different organizations like Greater Nashua Mental Health and Harbor Homes are out in the community, as well as the Nashua Soup Kitchen and Shelter, trying to engage a lot of these folks to get them into programs as appropriate or other resources that they might be willing to participate in. And we will continue to do that. One effort that's actually not in this report, but that we've been looking at, is working with DPW to clean up some of, it appears it's like last year's encampments, and as the snow is gone and as more people are out in the community, they see these things that were left over from encampments, so they're looking to clean that up and then establish some resources so hopefully people won't leave trash and things like that behind in any encampments that they may be staying in. So we're working with DPW, our community health workers, as well as the outreach teams to reach out to those folks that are staying in the encampments that may benefit from connecting and engaging in these other programs in the community to get shelter and or more permanent housing options. So one other program that was introduced that I'll just make note of, Eversource has started a new program. It's called the New Start Program, appropriately so, to help people that have past due payments in their electric bills to actually forgive some of those balances. So as we see a lot of people with some pretty extensive balances, if they qualify, we can work with Eversource to get them on a much smaller payment plan than we used to. So that will also reduce our need to assist with utility assistance, but it also helps the clients because any excessive balance may be forgiven over time. So it's a great new program because as they, as a customer, meet their obligation to make reduced monthly payments of that balance, a chunk of their balance is forgiven. So it's a great program. I probably didn't do it justice in explaining it, but if there are any questions about it, people can contact the Welfare Department or Eversource directly. And again, we continue to provide assistance in accordance with the statute. Director Bagley mentioned that through our budget presentation, we discussed positions within the department. We took a look at what our case technicians are really doing on a day-to-day, and in working with the staff and Director Bagley, we tweaked those positions and are proposing some changes. Is moving away from like a case technician, which is more a staff person that just determines someone's eligibility and either provides assistance or does not, to what we call a welfare specialist, because they have more knowledge of community resources and programs and do more case management type activity to connect to those resources, which benefits the client in the long run. It benefits our department and the city because it reduces our need to spend so much money, and it has a more longer term benefit. So those are some of the things we've been looking at within the
Great.
department. So,
Any questions? Seeing none?
Thank you.
Thank you very much, Paul.
thank you.
I'd like to open it to public comment. Seeing no public here, there is no public comment, I guess. Last, before adjourning, I won't be here for next month. Chuck has agreed, being the senior person, to be the chair, but you guys can work it out, whichever way you want to do it.
I'll be-
Duke it out, duke it out.
Noted.
So, nothing critical or anything, I just want to be here. And lastly, just
Being necessary.
like to say Happy Easter to everybody, and if you celebrate, and holidays, and enjoy your chocolate bunnies. Other than that, looking for a motion to adjourn?
So moved.
Second?
Thank you.
Adjourn. Thank you. Thank the staff. Nice reports.